Assalamualaikum and welcome. We will be starting shortly. Assalamu alaikum and a very good morning to all the honorable judges, professors, doctors, lecturers, and fellow friends. Welcome to the 12th UiTM Dental Student Scientific Symposium. Our theme this year is Inculcating Research, Embracing Knowledge. We would like to request all presenters and all symposium participants to fill in the attendance link on our website for the session. My name is Nina, and I will be your moderator for today's poster presentation session, and our timekeeper is Kaisara. We're really honored today to have Associate Professor Dr. Asma Al-Husna Habakatullah, Dr. Azliza Dada Zabha, and Dr. Noreen Nur Hasmon as our panel of judges for Magnolia. Please allow me to share a few house rules for today's session. All presenters must be ready at least 10 minutes prior to your allocated presentation time. All presenters are required to use the provided virtual background in our website for the Q&A session on the scheduled slot. The pre-recorded video presentation will be played by the committee for 10 minutes and subsequently followed by a 5-minute live Q&A session by the judges. For the presenters, please ensure your camera and microphone is turned on only during this session. First bell will be rang at 4 minutes of the Q&A session, and another bell will be at the end of the Q&A session. After the Q&A session ends, the moderator will cue to the next presenter. In case of any technical difficulties during the video presentation or the Q&A session, the other presenters must be on standby should the allocated time be brought forward or earlier. Without further ado, let's start with our first recorded poster presentation by Hanya Zara Dewanto with the research topic Analysis of Factors that Predict Indonesian Dental Students' Interest to Use Teledentistry.
Be presenting. A very good morning to one and all present here today.
Ladies and gentlemen, doctors and professor, good morning everyone. It is a great honor for me to be participating in the 12th UiTM Dental Student Scientific Symposium. My name is Hania Dewanto and I am an undergraduate dental student in Universitas Indonesia, and today I will present a poster about my research with the title of Analysis of Factors that Predict Indonesian Dental Students' Interest to Use Teledentistry with Professor Yuniardini Wimardani and Dr. Anandina Irmagita as my supervisors. Teledentistry is a new innovation that can facilitate access to treatment and education in dentistry during the COVID-19 pandemic, where interaction between individuals are being limited. Teledentistry can be used for diagnosis, consultation, post-treatment monitoring, and also for lectures. There has been an increase in the telemedicine users at the beginning of the pandemic, or in the year 2020, which reached 50% more than before the pandemic. This shows that teledentistry has a great potential to be one of dental treatment and dental education tools in the future. Final year dental students, who will graduate in 1 to 2 years to become dentists, will play an important role in the implementation of future dental care, including those through teledentistry. Based on a model that was proposed by Venkates, individuals' interests in using a system are influenced by their own characteristics, such as age and gender. Therefore, the study was conducted to determine students' characteristics' influence on interest in using teledentistry, and to also determine students' knowledge about the application of dentistry. Based on the Unified Theory of Acceptance and Use of Technology model, or the UTAUT model that was previously mentioned, an individual's interest in using a system are influenced by their own characteristics and also by four main constructs, and those four constructs are performance expectancy, effort expectancy, social influences, and facilitating conditions. A questionnaire was then created based on this model, and later on, Al Abdullah et al. Modified the questionnaire and made it specific to teledentistry for their research about predictors of dental students' behavioral intention use of teledentistry. And this was the questionnaire that was used for the study. The study was already ethically approved by Komisi Etik Penelitian Kedokteran Gigi Fakultas Kedokteran Gigi Universitas Indonesia, and we conducted this study using a cross-sectional analytic design, which is held in Faculty of Dentistry in all over Indonesia from October to November 2021, with an online questionnaire from Al Abdullah et al. That before we share the questionnaire was adapted to Bahasa Indonesia through a cross-cultural adaptation, and we also did a validity test with face validity and reliability tests with Cronbach alpha and test retest reliability on 21 respondents. Later on, we conduct a descriptive analysis to see the distribution of respondents and to see dental students' knowledge about application of teledentistry in fields or departments of dentistry. We also did a comparative analysis with men with me tests to analyze the relationship between respondents' characteristics and their interest in using teledentistry. The data collected are considered primary data that were obtained from 472 respondents, with the population of study respondents consists of 5th and 6th year dental students in Indonesia. The exclusion criteria for respondents were students who filled out the questionnaire outside the time limit of data retrieval. The data were then analyzed with SPSS and Smart PLS program. And these are the results. Men with me comparative test results show that there is a significant mean differences between performance expectancy behavior with differences in the characteristic of age, gender, and voluntariness. The result of men with me tests also showed that there are significant differences in the construct of effort expectancy, social influence, and behavioral intention with differences in voluntariness characteristics. The results showed that younger respondents may have more confidence that teledentistry can help with their work. The results of this study are in line with the findings of Lee et al., who also found that performance expectancy was higher in the younger age group. This may be because younger respondents grew up and received more education in the digital era if compared to older respondents, resulting in greater trust in technology. The results showed that female respondents had a higher belief that teledentistry would be useful for their work. This is in contrast to the previous studies, which state that men are more task oriented when compared to women, therefore have higher performance expectancy. The result of this study may indicate that women have different attitudes towards performance expectancy, perhaps because the respondents are dominated by women, and Indonesia's dental students were also dominated by women. This can also be to the dental profession education system in Indonesia, which still use a numerical requirement system where students must meet a number of standard cases or requirements that have been set by each institution to complete their professional education. So that this system can make all dental students have a task-oriented behavior and therefore affect their performance expectancy. The result also showed that the level of effort expectancy, performance expectancy, social influence, and behavioral intention is higher in respondents who use teledentistry voluntarily. According to the technology acceptance model theory, voluntariness is one of the most important things that moderates the intention to use a system. Therefore, the research results are in accordance with this theory. The descriptive analysis results showed that majority of respondents considered that teledentistry was most likely to be applied in public health and oral medicine, with 92.4% and 90% of total participants agree that teledentistry can be applied in public health and oral medicine. Majority of respondents also considered teledentistry was least likely to be applied in oral surgery and dental forensics, with 66.3% and 60.6% of total participants disagree that teledentistry can be applied in oral surgery and dental forensics. Respondents could perceive it this way maybe because the treatment in the field of public health and oral medicine do not always require face-to-face meeting and can still be done through video calls or through electronic information media such as e-poster. In contrast to the fields of oral surgery and dental forensics, where treatment in these two fields is identical to face-to-face meeting, namely to perform surgery and also to identify bodies. According to Tella et al. And Jampani et al., teledentistry can be used in all fields of dentistry, including the fields of oral surgery and dental forensics. where for the field of oral surgery, teledentistry can be used for post-operative control and also to diagnose impacted teeth. And for forensic, teledentistry can be used for data collection and exchange. The conclusion of this study is age, gender, and voluntariness influence the interest in using teledentistry, and dental students' knowledge about the benefits of teledentistry are still limited to a few fields. Exposure to teledentistry while still in dental school could increase knowledge about its benefits and also increase the likelihood of use as a practicing provider. That is all from me. Thank you very much for your attention.
Now, we would like to invite the judges and presenter for the Q&A session.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Hania, thank you for the nice presentation and a nice poster, yeah. Okay, my question to you is, how did you do the validation process for this study?
Thank you so much, Doctor, for the question. So I did the validity test with face validity. So after the participant filled out the form the first time, I asked to them if there are any confusing questions or if there is any confusion. I asked them what's the confusion and how they interpret every single question.
Why do you need to do validation?
I did the validation to make sure that my questionnaire has has questions that have the same meaning to all my participants, to make sure that my participant all have the same interpretation of the questions.
Right. So, based on your finding, what is your recommendation to go forward?
So I recommend an exposure to teledentistry while still in dental school by teaching teledentistry in each department so that students can be familiar with teledentistry. So in their clinical years and when they graduate as dentists, they will be more familiar with teledentistry and how to use it. Therefore, their interest to use teledentistry in the future will increase.
Right. Thank you very much. Any other question from the judges?
Yep, I do have one question. Hello, Hania. This is Dr. Azliza. Thank you for your presentation. Just a quick question. You have a background saying that teledentistry can be used for diagnosis and things like that. Is your university currently practicing it? Yeah.
Thank you so much, Doctor, for the question. So my university at the moment are using teledentistry for education. So because the pandemic situation, we do lectures and sometimes skills lab through teledentistry or through online classes. But for the treatment in our clinical years, we still haven't did teledentistry yet. So we still do it face to face.
Okay. Do you think that actually influence the respondents' way of answering your questionnaire?
Most of the some of the respondents for my questionnaires are also from my university, and I feel like it influenced them because because in our university we do classes where we are given cases, like there are actually patients and we have to do examinations and diagnosis on that cases as well. So it gives the image on how teledentistry is used in real life. So therefore, probably the students from my university will be more familiar with the teledentistry, and in answering my questionnaire, they will be more understanding about what I meant. Maybe.
Okay. All right. Thank you.
Thank you.
Dr. Noreen? Okay, so thank you, judges and presenters. Moving on to the next poster presentation, we will welcome the presentation from Parnika Misra, presenting the research title Non-Surgical Management of TMD. So this presentation will only be of a video presentation.
Today, I shall be presenting a case. A very good morning to one and all present here today. Today, I shall be presenting a case study on the non-surgical management of temporomandibular disorders. So without any further ado, let's dive straight into the presentation. So when we talk about temporomandibular disorders, what does the term temporomandibular disorder mean to us? So it is a term that is used to denote the collective group of musculoskeletal conditions that occur in the temporomandibular region. Now, these conditions, there are certain conditions which are characterized by pain, pain of the muscle of mastication, your TMJ, the preauricular region, or all of them as well. So this pain is one of the most characterizing features of the temporomandibular disorder. Talking a little about the anatomy of the TMJ, we see that it is a combination of two movements, the hinge action and the sliding movements. A little into the anatomy, we observe that the joint is covered by a fibrocartilage and is separated by a small shock-absorbing disc, which helps in the smooth movement of this particular joint. Talking a little about the prevalence of TMD, we will see that we observe an increase in the TMD with respect to increase in age. At the same time, this is a variable epidemiology where we observe that it is a population-based prevalence, where we see that certain areas may get around 6% of prevalence, while some have 68% of prevalence in them. So what was the objective of this presentation is to demonstrate the effectiveness of the non-surgical management of TMD at an early age. So diving now straight into the crux of the presentation, I shall be talking to you about the case report. So we had a 6.5-year-old boy who had walked into our department with her chief complaint of grinding of teeth at night. The history of presenting illness was given to us by his parents for about 12 months, where they have spoken about associated headache, associated frequent headaches, and vomiting along with the grinding of teeth. Upon inquiring about the medical history, we get to know that they had visited the ophthalmologist earlier recently, and no relevant findings had been given forth by the ophthalmologist, and who further referred him to the dentist for further treatment. So looking into the past dental history, there isn't much of history of relevance. So the extraoral examination we speak about the TMJ, where we examined the TMJ, and it was there we observed pain on chewing and clenching. Then talking about the muscles of mastication, the muscles of mastication were observed to be tender. On intraoral examination, we observed that the patient did not have any caries, but attrition was observed. If you can see in the picture, I have demarcated the same with arrow marks. You can see that attrition of the maxillary and mandibular primary and lateral incisors and canines was observed. Looking at all of this, the provisional diagnosis was put forth as TMD with bruxism. Differential diagnosis for the same case would be migraines or other kinds of headaches, otalgia, and cervical pain. All of these three differential diagnoses were later cleared as follows. Migraines, we ruled out migraine based on a clean slate that was given to us by the ophthalmologist. Otalgia was run over clearance by the words of a pediatrician and an ENT specialist, and so also for the cervical pain. So now, how did we move about with, or what was our plan of action for this particular case? So talking a little about the management of this case, we will be talking about, we have spoken to the patient and have gone through rigorous counseling sessions where we have started off by patient education, motivation, and biobehavioral moderation. So we've started off by breathing exercises in order to calm the patient down. Parent education and motivation was another form of therapy that was instilled. At the same time, an orthotic jaw appliance had been provided to the patient, which was a soft jaw splint. The entire goal of the management was to increase function, reduce pain, and to improve the quality of life of the patient. So as I would discuss about this case with you, I would tell you that this patient was referred to us with grinding at night. So the etiology for grinding or bruxism can be psychological or non-psychological in nature. So when we look at the psychological aspects of this, and when we have been through the counseling sessions, we have found out that there was sibling rivalry that had come into light. It was revealed. At the same time, it was pediatric comprehensive oral healthcare attitude, behavioral assessment of the patient, and counseling of the patient and the parent that played a very pivotal role in order to help us go ahead in this case. Now, during this, the symptoms were revealed and treated, and a treatment plan had been formulated for the same. A soft splint, like I had mentioned earlier, had been provided. So the applied knowledge of our applied sciences and in the various allied medical branches and their application and keen observation is what really helped us get to the bottom of this particular case. And it could have been done along with the aid of comprehensive treatment plan. So in conclusion, what I would like to tell you here is that since the TMD had been diagnosed in its initial stages, we were able to see the following very favorable outcomes. The patient was relieved of all his clinical symptoms. He had become more friendly with everyone, and the parents appeared cheerful and relieved as well. So the take-home message that I would like to share with you here is it is important for us to not only focus on the intraoral examination of the oral cavity of the patient as a dentist, but it is also important for us to keep in mind and focus on the overall well-being of the patient. For even that plays a very pivotal role. So, thank you.
Thank you to Parnika Mishra for her video presentation on non-surgical management of TMD. Alright, so moving on to the next poster presentation, please welcome Dr. Sharon Elsa Matthew, who will be presenting on knowledge and attitude on mouth-nose covering for COVID-19 protection among dental students.
A very good morning, respected jury members, professors, and my dear friends. Today, I would like to present to you on the topic, Knowledge and Attitude on Mouth-Nose Covering for COVID-19 Protection amongst dental students. Mouth-nose covering is an essential tool of self-protection against any airborne infection, especially in the case of severe acute respiratory syndrome coronavirus 2, also known as SARS-CoV-2. The main route of transmission is the inhalation of the virus either by virus-loaded respiratory droplets or the aerosol that is generated from a COVID-positive person. In dentistry in particular, there is a high probability of infection among healthcare providers due to the close face-to-face proximity and aerosol exposure that happens during intraoral operative or surgical procedures. Hence, the aim of the study is to analyze the knowledge and attitude of the use of mouth-nose covering amongst the dental students of our institution during the COVID-19 pandemic. After obtaining the Institutional Ethics Committee clearance, 245 willing participants were given a questionnaire via Google Documents, and these questions were segregated based on their knowledge of the various types of masks, the proper technique, the use, the maintenance, disposal, etc., and understanding their attitude towards it in the COVID-19 pandemic. When we asked about the knowledge on the topic, we have found the following results. When asked about the layers of an ideal face mask according to the WHO guidelines, about 60% of our students answered correctly that the ideal layers of the face mask is composed of the inner absorbent material, cotton, middle layer of non-woven, non-absorbent material, that is polypropylene, and an outer layer of non-absorbent material such as polyester or polyester blend. However, there was a good 40% majority who were not aware of this. Coming to the second question, according to WHO, the effective method of wearing a mask is by covering the mouth, the nose, and the chin. The chin is to be covered so as to provide a proper seal and avoid the slippage of the mask. When asked about this, we were surprised to find out that only about 75% of our students answered that only the mouth and the nose be covered, while only 25% of our students knew about this. Coming to the third question, when asked about the correct way of wearing a surgical mask, we were glad to know that about 80% of our students knew that the white side is to be facing inwards for the proper wearing, as the colored surface is the non-absorbent layer that prevents the aerosol particles from absorbing towards the inner layers. Coming to the fourth question, we asked which mouth nose covering offers the best protection, and we were surprised to find that most of our students answered that an N95 mask is the best that provides protection to a dentist performing aerosol procedures, although it actually is the N95 respirator, as it provides a tighter fit and a better seal. Only 15% of our students answered this correctly. Now, coming to the fifth question regarding exhalation valves and vents in masks, the CDC does not recommend the usage of these masks because these masks have one-way valves or vents that allow the air to be exhaled unfiltered, that can result in expelled respiratory droplets that can reach others. And when we asked our students about this, about 66% of our students answered correctly that they should not be recommended in a healthcare setting. Coming to the sixth question, since there is an increased use of N95 masks in the past 2 years, we asked our students regarding the certification categories under NIOSH, which are the N, R, and P depending upon their resistance to oil as resistant, strongly resistant, and partially resistant categories. When questioned about this, we realized that most of our students were not aware of this classification, as 68.9% answered virus, and only 8.2% answered correctly that it is oil. Coming to the seventh question, when asked about the best way to protect against the virus in a workplace, we were very glad to know that majority of our students, 91%, knew that the best way of protection is to have all masks, which includes oneself as well as others. Coming to the next question, apart from the NIOSH categories, we also asked our students regarding the European Safety Federation categories of masks that are available in India as well, which are the FFP1, 2, and 3. And the European equivalent to an N95 mask is the FFP2. And we were surprised to know that only about 38% of our students actually knew about this, and about 39% of our students actually answered FFP3. Coming to the next question, when asked about what a student assisting in aerosol generating procedure should ideally don, about 78.3% of our students answered that an N95 mask is enough. An N95 respirator is the one that is most ideal for an assistant because they would also be exposed to aerosol particles as well. About 99.8% students only answered this correctly. Coming to the 10th question, which is the final question, we asked our students on which is the most critical component of the PPE that offers the best protection during an aerosol generating procedure. And only about 66.4% of our students answered correctly, although we expected a total 100% answer on the mouth-nose covering. But there was a 29.9% who answered that it could also be the coverall or the gown as well. Coming to the questions that were used to assess the attitude of the students were also asked to select among the options whether they strongly agree, or are neutral, or they disagree or strongly disagree upon the following statements. The first statement is it is essential for all students to be educated regarding the importance of mouth-nose covering in a workplace and clinical setup before the start of college. Most of our students completely agreed to this answer, as strongly agreed answer was selected by about 84.8% students and 11.9% agreed. Coming to the second statement, that it is essential for students to undergo training in appropriate technique of donning and doffing of various types of mouth-nose coverings in the workplace and clinical setup before the start of our college. Many students agreed to this answer as well, as 78.7% strongly agreed, 18.4% agreed to this statement. Coming to the third statement, that it is essential for everyone in the workplace to effectively use a mouth-nose covering at all times. 77.9% strongly agreed, 18.4% agreed, and a fraction was neutral to this topic as well. Coming to the fourth statement, it is necessary for the institute to provide an N95 mask or a respirator when performing intraoral procedures on patients. 79.1% strongly agreed, 15.2% agreed, and 5.3% were neutral on the statement. Coming to the fifth statement, I recommend the banning of valve masks in the workplace and clinics. Most of our students, that is 40.2% only strongly agreed, whereas 28.3% agreed and 28.7% were neutral on the statement. Coming to the next statement of fine or disciplinary action being taken against people not effectively using a mouth-nose covering in the workplace, 48.4% strongly agreed, 37.7% agreed, and 13.1% were neutral on the statement. Coming to the eighth statement, in my college, if my batchmate is posted with me not wearing a mouth-nose covering appropriately, I would request my batchmate to don it properly. 64.8% strongly agreed, whereas 27% agreed, and 7.8% were neutral on the statement. Coming to the next statement, in college, if a faculty is sharing a room without adequate ventilation with me and is not wearing a mouth nose covering appropriately, I will request the faculty to don it properly. Only 50.8% strongly agreed, whereas 29.9% agreed, and about 18% were neutral on this statement as well. Coming to the next statement, it is necessary to remove the mouth nose covering to effectively communicate with the patient during the pandemic. 47.8% agreed. Strongly disagreed, strongly disagreed, whereas 20.9% disagreed, and 8.2% were neutral, 7.4% agreed, and 16% strongly agreed to the statement. The final statement, it is necessary for the faculty and the students to remove masks during university viva examination for effective understanding and communication. About 44.3% strongly disagreed to the statement, 13.1% strongly agreed to the statement, whereas 23% disagreed, 9.4% were neutral, and 10.2% agreed to the statement. I would like to conclude by stating that our study showed that majority of the respondents had some basic knowledge of the importance of mouth-nose covering. They were also willing to voice the need to follow appropriate masking procedures. However, the need to reinforce this still seems very important. Thank you.
Now, we would like to invite the judges and presenter for the Q&A session.
Good morning, Dr. Sharon. I just start first. I just would like to know, why do you choose dental students as your respondents, knowing that wearing masks is part of our infection control protocol in dentistry? So I would like to know why you choose dental students. Sorry, you are muted.
Tak dengar.
We couldn't hear you, Sharon.
Still can't hear you. Yep. Did she answer the question?
Maybe you can answer through chat box, Sharon.
I think.
Sharon, can you type your answer in the chat? Right. Thank you, Sharon, for the presentation. I think MC, can we go to the next presenter? Thank you, Sharon.
Okay, thank you, judges and presenters. Moving on to our next poster presentation, we will welcome Deepak Das and Richa Mandolin, by which we will only be playing her video presentation titled The Virtual Patient Guided Implant Dentistry at its Most Advanced Stage.
Presentation number EI03. Good morning everyone. Today we are here to present an e-poster on the topic The Virtual Patient Guided Implant Dentistry at its Most Advanced Stage.
So coming to the introduction, we can see that the rehabilitation of adventitious maxilla is a challenging procedure. So our rigorous study concentrates on a new method to superimpose intraoral optical scan image and the CBCT scan image of the adventitious maxilla using a modified radiographic template. So two devices are required for this procedure. One is CBCT and the second one is the intraoral scanner. CBCT stands for cone beam computed tomography. It consists of a rotating part which captures images at various angles, and the produced image will be in the DICOM format. DICOM stands for Digital Imaging and Communication in Medicine. It is used to visualize anatomical structures, more specifically the bony structures and the tissues. And these images are then transferred to the computer. The second one is the intraoral scanner, which is used to scan the oral cavity in a more precise way. And the image font will be in the STL format. STL stands for the Standard Triangle Language, and it is very convenient for the patient, and the images is then transferred to the computer. Both these images are then combined using a software which is used for guided implant placement and for ortho-analysis.
Now, let's look into the procedure of guided implant placement. In the first stage, as we see in the first image, a radio-opaque template with 3D radio-opaque markers are inserted. A minimum of 4 radio-opaque markers are inserted so as to prevent any problem when performing the digital matching. Radiographic template is modified to expose the palatine rugae. In the second stage, 2 complete digital impressions are obtained using an intraoral scanner. As we see in the second and third images, the first impression should be done with a radio-opaque template, and the second image impression should be obtained without a radio-opaque template. In the next stage, a CBCT scan is obtained when the patient wears a radiographic template. This is an image showing a patient wearing a radiographic template. Further, the DICOM file from CBCT and the STL file from iOS are imported into computer guide surgery software and is superimposed. After the superimposition, we can proceed with the digital implant supported rehabilitation planning, that the bone quality, quantity, the software and prosthetic plan are merged together.
So the advantage is it is possible to obtain a 3D information of patient's anatomy and has got a cost minimization function. Less chair time is required, and so the patient will be more comfortable. So we can conclude that it is now possible to create a 3D virtual patient for better diagnose, to better diagnose, plan the treatment, and to communicate with the patients. Thank you.
Thank you.
Thank you to Deepak Das and Richa for the Virtual Patient Guided Implant Dentistry at its Most Advanced Stage video presentation. Moving on to the next poster presentation, we will welcome Tasha Lei, who will be presenting on the level of awareness, attitudes, and perceptions of oral health care among students of Health Science Cluster, Universitas Indonesia.
Representative. Hello, my name is Tasha Lai as a representative of our research team. It's my pleasure to welcome all the participants for this online virtual conference at 12 UiTM Dental Student Scientific Symposium. Today, I will present a poster about the level of awareness, attitudes, and perception of oral health care among students of Health Science Cluster, Universitas Indonesia, with Dr. Masita Mandasari and Professor Yuniardini as my supervisor. As the background, oral health refers to the health of the teeth, gums, and the entire mouth-face system that enables us to smile, talk, and chew. Poor oral health can worsen general health condition. Good collaboration between health workers is important to providing oral health care. In order to promote collaborative oral health care education is needed. The objective of our study is to determine the level of awareness, attitudes, and perception of oral health care among students of Health Science Cluster Universitas Indonesia Batch 2021. The methods we use on our study is a cross-sectional descriptive analytical research design. The sample of the study includes the entire target population of Faculty of Nursing, Faculty of Medicine, and Faculty of Dentistry Health Science Cluster Universitas Indonesia Batch 2021. Research was conducted by distributing questionnaire via Google Form to students of the Faculty of Nursing, Faculty of Medicine, and Faculty of Dentistry Universitas Indonesia, batch 2021. The questionnaire used was adapted from the questionnaire used in the study of Aresaku. The questionnaire has gone through a process of cross-cultural adaptation and testing of its reliability and validity. Sampling was carried out using the total population sampling technique, and the inclusion criteria for the research sample were students of the Faculty of Nursing, Faculty of Medicine, Faculty of Dentistry, batch 2021, who filled out the questionnaire and signed the informed consent. And then the collected data were analyzed using SPSS. As the result, the level of awareness, attitude, and perception among students of Health Science Cluster Universitas Indonesia batch 2021 is high at 50.5% of respondents. However, the result obtained may be said to be not quite satisfactory. The unsatisfactory results are associated with the characteristic of respondents who are the first-year students who have not received lecture about oral health care. They haven't been exposed to any material related to teeth and mouth, considering the data collection was carried out at the beginning of the first semester. Students of the Faculty of Dentistry themselves have just studied about general health. Besides that, the level of awareness, attitude, and perception of students from the Faculty of Nursing is lower than students from the Faculty of Medicine and Faculty of Dentistry. This is similar to the research by Harisaku that nursing student attitude towards oral health care tend to be negative. The Faculty of Dentistry tend to have a high level of awareness, attitude, and perception compared to nursing student and general medical student. These results are presumably because nursing and medical students tend to think that they will become non-oral health professional after getting their professional qualification. The level of awareness, attitude, and perception of oral health care among Health Science Cluster Universitas Indonesia is influenced by student study program. So that it is necessary to increase education about oral health care, especially for students from Faculty of Nursing who have low level of awareness, attitude, and perception about oral health care. Education is to be given as early as possible, starting at the beginning of the first semester. In addition, it is necessary to make special modules about oral health care for students of Faculty of Medicine and Faculty of Nursing. It is necessary to consider improving learning method and curriculum to increase student skills about oral health care. We also studied the factor associated with the positive willingness of students to practice oral health care after becoming a health professional. As we can see from the table, lack of perception about oral health care, high interest in oral health care, high level of perception about how many proportion of their duties will be spent practicing oral health care after qualification, and high level of perception regarding treatments of oral health care they need to learn were associated with a positive willingness of students from the Faculty of Nursing, Faculty of Medicine, and Faculty of Dentistry to practicing oral health care after obtaining professional qualification. In conclusion, most students had high level of awareness, attitude, and perception about oral health care. The level of awareness, attitude, and perception were influenced by student study program. And as the recommendation from our study, the level of awareness, attitude, and perception among students of health science cluster needs to be improved. Maybe that's all from me. Thank you so much for your attention.
Now, we would like to invite the judges and presenters for the Q&A session.
Hi, Tasha. Dr. Lisa here.
Hi, good
Hello.
morning, doctor.
Yeah. Thank you for your presentation. You have made a conclusions of most student, which is only comprises like 50%. Why did you make that such conclusion? Is it referring to existing studies? Because if you look at it, it's 50% is actually only half. I wouldn't. I mean, I personally wouldn't conclude it as most. Can you explain that?
Thank you for the question, doctor. Actually, I made it by I made the classification by the median of the result of the data, and then made it to good and then low about oral. Maksudnya about the awareness and then perception about oral healthcare.
Okay, thank you. So another half would have a very low perception, right?
Yeah, yes.
It's either high or low, right? For your question,
Yes.
you
High and
yeah.
low.
Okay. I think this is very important because as we start working, we can see that there's a big demarcation between oral health and health. Health seems not to really know about oral health, right? That is why you can you hear me? I mean, this study actually is very good. I mean, as you can see, even at the college level, even at the undergrad level, we can see that if you're non-oral health, you don't really know awareness about oral health. So it's important to make sure that our colleagues know about oral health as well, so they can help us in a way. But actually, your study show actually the 50%. I mean, almost half don't really know about that. I just want to clarify the dental student is actually a first year dental student, right? The
Pardon?
respondent, the
Yes.
respondent for the dental student is actually
Yes.
the first year dental student,
Yes.
right?
They are a first year, which is not exposed to
Yeah.
oral healthcare education, just general health education.
Okay. All right. Thank you.
Thank you so much, doctor.
Okay, I think we can move to the next presenter. Thank you, Tasha.
Thank you so much, doctor.
We will have a 2-minute break to give time for the judges to discuss and evaluate the presentation. Moving on to the next poster presentation, who's welcome Debelina Bishai, who will be presenting on a novel application of a Bioactiva smart material as a pit and fissure sealant, evaluation of sealing ability, adaptation and penetration, and in vitro project. This presentation will only be of a video presentation.
Greetings to everyone. The title of our research work is A Novel Application of a Bioactiva Smart Material as a Pit and Fissure Sealant. The team members are Debolina Bishai, Aishwarya Srinivasan, Dr. Karuna Y.M. and Dr. Shrikant N. Done in Department of Periodontics and Preventive Dentistry and Department of Oral Pathology and Microbiology, Manipal College of Dental Sciences, Mangalore, Manipal University.
Dental caries is one of the most common intraoral diseases. Pit and fissure caries accounts for 44% of caries in the primary teeth and 80 to 90% in the permanent teeth. Available evidence suggests that sealants are effective and safe to prevent or arrest the progression of non-cavitated carious lesions. Resin-based sealants and glass ionomer sealants are generally used for the purpose of pit and fissure sealing, but their disadvantages include polymerization shrinkage and moisture sensitivity. And also fracture of the material can occur due to its reduced ability to withstand occlusal forces. The compromised retention is other drawback. Bioactive smart material are a relatively new concept in dentistry. They are reported to release more fluoride than glass ionomers, and their unique chemistry supports the natural remineralization process and helps form a seal between the material and the tooth. Additionally, they react to pH changes in the mouth by uptaking calcium, phosphate and fluoride ions to maintain the chemical integrity of the tooth structure. One such recent introduced new smart material is the Activa Bioactive Base Liner. According to its manufacturers, it combines between the strength and aesthetics of composite resins and the benefits of glass ionomers such as moisture tolerance, chemical bond to the tooth, and release and recharge of calcium phosphate ions in addition to fluoride. All of these properties of Activa Bioactive instigate us to evaluate its ability to be used as a pit and fissure sealant. However, apart from the above said properties, penetration of the material used into the complete depths of pit and fissures, its lateral wall adaptation, and subsequent retention are the key factors in the longevity of pit and fissure sealants. Apart from the penetration depth of the sealant, extension of the sealant material over the enamel of the cuspal inclines is another factor considered in successful bonding of pit and fissure sealant to the tooth. The objectives of our study is comparison of sealing ability, penetration and adaptation of a bioactive smart material used as a pit and fissure sealant to those of glass ionomer sealant. Null hypothesis is that there won't be any difference in properties of the bioactive smart material when compared to those of GIC fissure sealant.
Materials and methods. The study was conducted on permanent teeth, premolars and molars, extracted for orthodontic and therapeutic purposes. The stereomicroscopic analysis was done in the Department of Oral Pathology in Manipal College of Dental Sciences, Mangalore. The methodology: 20 non-carious erupted intact permanent teeth extracted for orthodontic and therapeutic purposes with deep pits and fissures were selected. After thorough rinsing and air drying, the teeth were randomly divided into two groups of 10 teeth each. The group 1, that is the bioactive smart material sealant. The tooth was slightly dried, removing excess moisture. The mixture was placed on the Activa syringe. The material was dispensed onto a mixing pad with the help of a plastic filling instrument. A disposable fine brush was used to spread it on pits and fissures, and sealant was then allowed to flow for 10 seconds. It was then light cured using 20-second low intensity light setting. Group 2, type 4 GIC sealant. The occlusal surface was gently cleaned with a GC conditioner for 20 seconds and rinsed for 20 seconds. The surfaces were then dried by blotting with cotton pellet. The GC Fuji4 glass ionomer cement was mixed as per the manufacturer's instructions and applied to the occlusal surface using a plastic filling instrument. A disposable fine brush was used to spread it on pits and fissures, and sealant was then allowed to flow for 10 seconds. After that, sealant was light cured for 20 seconds, followed by application of petroleum jelly on the occlusal surfaces. Following sealant application, the teeth were subjected to thermal cycling for 1500 cycles, alternating between 5 degrees Celsius and 55 degrees Celsius. evaluation of sealing ability, sealant penetration and adaptation with 10 teeth per group. The apex of each tooth was sealed using composite resin, following which 2 layers of nail polish was applied to within 1 mm of the sealant margin. The teeth were then immersed for 24 hours in 1% methylene blue solution buffered at pH 7. They were then rinsed under running water for 10 minutes and cleaned. The specimens were completely embedded in clear autopolymerizing acrylic resin and were sectioned longitudinally buccolingually from the central fossa, yielding 2 sections of 500 micrometers per tooth using a water-cooled diamond disc mounted on a saw at low speed. Sections were then viewed using a binocular light microscope at a minimum magnification of 4x for fissure morphology, sealant penetration, unfilled space, lateral wall adaptation and for any voids. The parameters that were studied include fissure morphology, sealant penetration depth, length of unfilled space, total length of fissure and penetrability percentage. All the linear measurements were made with the help of software ImageJ and calculated in microns. 3 measurements of each section was taken and the mean value of these readings per section was adopted as the representative values. The values were then tabulated and subjected to statistical analysis. The result: comparison of the sealant penetration depth between the two groups shows that sealant penetration depth is higher in group 1 group with a t-value of 0.099 and is statistically non-significant with a p-value of 0.922. Comparison of the length of unfilled space between the two groups shows that length of unfilled space is higher in group 1 group with a t-value of 1.593 and is statistically non-significant with a p-value of 0.145. Comparison of the total length of fissure between the two groups shows that total length of fissure is higher in group 2 group with a t-value of 0.536 and is statistically non-significant with a p-value of 0.6. Comparison of the penetrability between the two groups shows that penetrability is higher in group 1 group with a t-value of 1.712 and is statistically non-significant with a p-value of 0.104. Comparison of the microleakage scores between the two groups shows that microleakage scores is higher in group 1 group with a t-value of 0 and is statistically non-significant with a p-value of 1.
The conclusion for this research study is that within the limitations of the study, a novel application of Activa Bioactive Smart Material as a sealant material was successful in terms of penetration properties and microleakage. Thank you.
Thank you to Debalina Bishai and Aishwarya S. for their video presentation on a novel application of Bioactiva Smart Material as a pit and fissure sealant, evaluation of sealing ability, adaptation and penetration, and in vitro project. We will now have a 2-minute break to give time for the judges to discuss and evaluate the presentation. Moving on to the next poster presentation, please welcome Dr. Parthivi Sharma, who will be presenting on review on pulpodentinal regeneration, boon or bane.
Good morning, everyone. My e-poster is on review on pulpodentinal regeneration, boon or bane. And before I start, I would just like to say that all the diagrams in this e-poster are hand-drawn by me and are just for pictorial representation. So let's dwell right in. This e-poster focuses on the regenerative potential of all the stem cells that are present in the tooth structure and how these stem cells help in the regeneration of dental and non-dental tissues. There are ongoing researches which have proven successfully given results where from these very stem cells, non-dental and dental tissues have been regenerated. This poster also highlights the prospect and the futuristic approach that dentistry can uptake in the near future, where stem cells can be used for pulpodentinal regeneration. So stem cells in the tooth. The tooth harbors a number of stem cells in various structures like the pulp, which are the dental pulp stem cells, the apical papilla, also known as scap, the pulp of deciduous teeth, known as shed, the dental follicle, known as dental follicle stem cells, and there are also periodontal stem cells. These stem cells on isolation and culturing have pluripotent potential, and this potential is possibly due to their ectomesodermal origin, which helps them to have the inherent programming factors where they can generate differentiated cells. Now, how will this change dentistry? The current treatment plan focuses on salvaging the pulp, but the concept of regenerating the pulp has added a different dimension to the future of dentistry. Epexogenesis, revascularization, bone augmentation, and pulpless canals can undergo pulpal regeneration. This approach is also in line with the concept of conserving the tooth structure in the best way possible. Here is a diagrammatic representation of various dental stem cells, the one found in the pulp, shed, scap at the apical papilla, and the dental follicle stem cells. And these histological diagrammatic representation shows the various non-dental tissues that they can regenerate. Now let's focus on a few researchers. Dental pulp stem cells can promote differentiation and proliferation of neural cells in the hippocampus of mice. They can form bone when combined with platelet-rich plasma or hydroxyapatite. They can engraft and stimulate angiogenesis and vasculogenesis in model of hyaline ischemia of mice. They can display myogenic potential when injected into dogs with muscular dystrophy. They can generate tooth structure. Now, what is the most effective combination for pulpodental regeneration? There have been many researches, and the best way that pulpodentinal regeneration can occur is through a magic triad. There is a tissue scaffold, growth factors, and dental pulp stem cells, which are isolated. The combination of the three yields the best result, and this is what the researchers say till now. The clinical implication is they can help in bone regeneration, they can help in pulpal regeneration, they can help in revascularization of pulp, they can help correct apical defects, they help in periodontal regeneration, and they also help in the regeneration of the nerves of the pulp. Moving on, this is the methodology, how the process of isolation of the stem cells to culturing them and to producing a differentiated cell is done. So first, there is extraction of the tooth. It could be any tooth, an adult tooth, a deciduous tooth, or a tooth which is unerupted with an intact dental follicle. Now this is stored in a transport media with penicillin, streptomycin, and 5 mg per ml amphotericin B. Now, there are various methods of stem cell identification, and the appropriate method could be used. Different researchers use different methods. There are methods like fluorescent antibody cell sorting, protein cell markers like CD146 can be used, immunomagnetic bead selection can be done, or immunohistological staining can be done. Now, Once the stem cells are identified, the pulp is isolated. It is cut into small sections and then it undergoes two processes, enzymatic digestion or outgrowth methods, both of which, after undergoing these two methods, the pulp cells are then put in cultural medias, and specific cultural medias give rise to specific differentiated cells, after which they are cryopreserved and they undergo magnetic freezing. And then these cells can be used for clinical trials. Once the clinical trials are successful, the combination of growth factor, dental pulp cells, and tissue scaffold can be used for successful pulpal regeneration. Now let's move on to the advantages and disadvantages of these methods. The advantages are they preserve the natural tooth structure. They are minimally invasive. When autologous stem cells are used for implantation, they reduce host immune cell rejection. Using the stem cells for regeneration of future non-dental tissue generation can also be done. And these advantages have a great prospect of using this technique in the future. Now, limitation. Firstly, appropriate cell markers are needed, and researches are still going on what are the exact cell markers that we can use. The sourcing of the stem cells is a big limitation. There is no medium that enables the stem cells into directly differentiate into tooth germ cells. You can create differentiated cells of the pulp, but the germ cell is still, there is no medium that enables us to recreate the tooth germ cells. There is concern over host rejection, and one of the biggest concern is tooth banking and the awareness of this whole process. Now for conclusion, tooth rebirth. The possibility surrounding the effective regeneration of dental and non-dental tissue is of mammoth proportion. And there has been substantial success in this field, and the prospect of changing the future of dentistry underlies with this process. On the contrary, there are limitations that need to be prioritized, optimized, and integrated in order to develop this technology successfully. Here is a case study that is done by my guide, which shows the before and after radiographs where there has been successful closing of the apex with the scaffold material. And this helps in regeneration of pulpodentinal structures. Here are the references. Thank you for your time.
Now, we would like to invite the judges and presenters for the Q&A session.
Okay, thank you, Dr. Partivi. Yes, Dr. Partivi, yeah?
Hello, am I audible?
I can hear you now. Okay, thank you for the nice drawing, very cute.
Thank you.
Okay, my question is this a review?
Yes,
review
this is a
things
review paper. Yeah.
paper. So, what is the method of reviewing your evidence? What is your method?
So we have overseen a few original researches. With my guide, I have selected a few researches with different type of regenerative methods that have been used. Like some have basically each cell, like a dental papilla cell or each type of stem cell, has the regenerative potential to differentiate into a new cell. But different medias have to be used as cultural medias. That way, we've segregated around 12 to 13 research papers and we've read them and done this review accordingly.
So do you have any inclusion, exclusion criteria for selecting the papers?
This was based on not any specific criteria, but on the successful the papers that showed successful researches. We just included those as of now, since this is just a review paper. post this, we'll be doing an original research as well. But this is just a review poster based on that, just to give a head start to the initial stage of the study.
Right. When you do the searching for the literature, what database do you use?
We have used Eduvisor, we've used Mendeley, and we've segregated this and we've come to this.
Okay, so after all this, so what is your clinical recommendation?
Hello?
Yeah. Can you hear my question?
Hello?
Data close.
Hello? Hello?
Yes, doctor.
I'm having
Can you
some
hear?
connectivity issue. Hello? Yes, can you repeat the question?
My question is, my last question is, what after getting all the review paper and all the findings, so what is your clinical recommendation? So what are you going to go forward? How are you going to go forward after this?
Hello? I'm really sorry. Can you please repeat the question? I'm having some connectivity issues.
Okay. My question is, what is your clinical recommendation after this? How do you go forward?
Okay, so this is a very futuristic approach towards dentistry. And right now, there are a lot of ongoing researches that have been happening where they have been able to segregate stem cells. And the approach or the proceedings would be that currently you can use scaffold materials like embryonic membranes from eggs and everything, like they are available. And my guide has been doing this research where she has used a source of the embryonic membrane and she's done apex closure. So we'll be going forward on those steps and using this technique in the regenerative potential. But to extract stem cells and to successfully use them and make them commercialized enough to use it in the market is a very long term approach, but it has a lot of potential in the future.
Right. Okay. Thank you, Dr. Parthivi, for the answer. Can we go to the next presenter?
All right. Thank you so much.
Thank you, judges and presenters. Moving on to the next poster presentation, please welcome Shivani N, who will be presenting on assessment of antibacterial property of mineral trioxide aggregate with chlorhexidine.
You all, I am Shivani and I am representing Savita Dental College, and today I am going to present a poster on the topic assessment of antimicrobial property of MTA. So the pulpal inflammation, also called as pulpitis, is mainly caused by an opportunistic infection of the pulpal space caused by oral microorganism. The most common route of entry of these oral microorganism is through dental caries, and the other routes include cracks through dentinal tubules and through the main apical foramen. Now, coming to the main aim of endodontic therapy, the main aim of endodontic therapy is debridement and cleaning of the root canal space. And once these two are done, shaping of the root canal space can be done in order to obtain an inert material which will further prevent the chances of reinfection. And the properties of this inert material must include it should be biocompatible, it should be non-toxic, it should have a very good sealing ability, and along with all these three, it should be moisture resistant. Given, I mean, in some cases, even after the chemomechanical treatment is done of the root canal system, the bacteria might still harbor to the dentinal tubules, and which will lead to the failure of the conventional root canal therapy. And so by this, I mean to say that along with all the properties of the inert material which I listed above, the main property of the inert material should be its antimicrobial or its antibacterial effect. Now, talking about mineral trioxide aggregate, this cement was first introduced by Mohammad Tora Benijad in the year of 1993. And only in the year of 1996, the antimicrobial effect or the antimicrobial property of the material was studied. So it was known that the material, the mineral trioxide aggregate, had very good sealing ability, and it was antibacterial. So, owing to these properties, owing to its chemical and physical properties, it was highly recommended for use in endodontic therapy, along with the properties which I listed before. One of the excellent properties of mineral trioxide aggregate is its ability to induce the hard tissue formation. So now talking about chlorhexidine. Chlorhexidine has been routinely used as a disinfectant owing to its broad spectrum antimicrobial properties. And in the early 1960s, the property chlorhexidine was used as an endodontic irrigant, as it has a wide spectrum of wide antimicrobial spectrum, and it is very effective against E. faecalis, the strain which we used for the study. So various studies have been done on chlorhexidine when mixed with chlorhexidine when mixed with other dental materials, which were a success. And hence the aim of our study was to assess the antimicrobial property of MTA when mixed with chlorhexidine. In this study, we had compared two groups, which include group 1 as the MTA with distilled water, and group 2 as MTA when mixed with chlorhexidine. So in this the study was conducted on double layered plates, in which the base layer of the plate was covered with tryptone soya agar, which was poured in sterile petri dishes. So a total number of 5 plates were employed. A sterile swab was used to inoculate E. faecalis on the agar plates to form a lawn of the growth, to achieve a lawn of growth. And then 2 uniform wells of 4 diameter were punched in an agar plate equidistant from each other. And the MTA was mixed according to the manufacturer's instructions, which is using 1 gram of MTA with 3.5 ml of water. And the same way, chlorhexidine was also mixed with MTA. And as soon as the mixture was prepared, it was transferred to the agar plates, and it was incubated at 37 degrees Celsius for 24 hours. After which, the zone of inhibition was calculated using a millimeter scale. Test was used to compare the mean zone of inhibition between the materials used, and the statistical significant differences among the groups were set at p less than 0.05. Now coming on to the results part, the zone of inhibition of MTA with MTA liquid was found to be higher than that of MTA with chlorhexidine. And the mean zone of inhibition of MTA with MTA liquid was found to be 25 while that of MTA with chlorhexidine was found to be 21.8 And MTA with distilled water has statistically higher zone of inhibition when compared with MTA with chlorhexidine, which is p less than 0.5, which shows the statistical significance. So in our study, we had used E. faecalis as our prime organism, as our isolated organism, because in most cases of retreatment and in most endodontically treated tooth, this was the most common isolated organism that we found. And about 24 to 77% of the E. faecalis strains were found in endodontically treated tooth, which shows that there are certain virulence factors present in E. faecalis which have the ability to survive the effects of conventional root canal therapy. And once a root canal therapy fails, the surgical intervention comes into limelight. We had employed the agar diffusion method, which is one of the most employed techniques for testing and assessing the antimicrobial properties. Although there are a few limitations of this method, One includes that it does not distinguish between bacteriostatic and bactericidal effects. And along with the zone of inhibition, it is also related to the diffusibility of the material in the agar. Also, there are other factors which play a role, which includes the um, inoculum size, the inoculation period, and the incubation period. That of MTA with chlorhexidine. So a few studies have been done which replaced MTA liquid with chlorhexidine to enhance its antimicrobial properties. And as per reports, it was suggested that MTA, when mixed with chlorhexidine, had greater zone of inhibition than MTA when mixed with MTA liquid. So there are other studies which state that the antimicrobial properties of MTA can be enhanced by incorporating silver nanoparticles. It is known that the antimicrobial property of MTA is due to its alkalinity. So, the pH of MTA when freshly mixed is 10, and after 3 years it increases to 12. So, it is reported that at the pH of 12, it could actually terminate all major microorganisms, including E. faecalis. So, the antifungal activity of MTA could also be attributed to its high alkalinity. Also, in the current study, MTA had its inhibitory effect on E. faecalis, and in a study done by SEMI, it was seen that MTA did not possess any inhibitory effect against E. faecalis. This could be due to the differences in the studies. So, in the present study, we had wells in the agar in which the MTA was MTA was packed in fixed quantities, where in the opposing study, MTA was just inoculated on the surface of the agar. So this could be due to the a few other studies state that enhancing the antimicrobial effect of MTA when mixed with various liquids could adversely affect its other properties like compressive strength, biocompatibility. However, further studies are necessary to evaluate the properties of this mixture. Um, from this study, I would like to conclude that MTA with MTA liquid showed higher antimicrobial effect than MTA with chlorhexidine. Thank you.
Next, we will now have a 2-minute break to give time for the judges to discuss and evaluate the presentation. Now we would like to invite the judges and presenters for the Q&A session.
Good morning, Madam.
Good morning. Thank you for a very nice presentation. I just have one question. You mentioned in your presentation that previous studies have shown that MTA mixed with chlorhexidine showed better antibacterial properties, but your results showed otherwise. Could you just tell us why? What is the main reason for this? The current results.
There are many reasons actually. One of the reasons could be the brand of MTA that we used. We used gray MTA, while the other study had used white MTA. The other reason could be the concentration of chlorhexidine that we used. I had used 2% of chlorhexidine, while the other study had used 0.12% of chlorhexidine.
Okay, so why you don't follow the protocol of previous studies, and why is there any particular reason you made the changes?
The changes were made because research is supposed to bring something new, and I wanted to do something new. Since I mean, I could have done that, and I do intend to do it in the future. The same quantity of the same concentration of chlorhexidine mixed with other brands of MTA. I intend to do it in the future.
So if you were to do the same study in the future, what would you do differently?
I would mix MTA with other liquids like sodium hypochlorite. I would mix it with saline. I would use other irrigants along. And I would also try mixing MTA with GIC liquid to see if there are any better results. Since GIC is also known to be biocompatible and has excellent results, I would mix MTA with GIC.
In your from your reading, have you encountered any other studies using that method?
None. No studies have done that. I would want to be the first one to do it.
Okay. Is there any other questions from the other judges? No. Thank you, Shivani.
Thank you.
Thank you, judges and presenters. Now we will invite once again the judges and the presenters to another segment of the Q&A session for presentation 01, Parnika Misra, on her research non-surgical management of TMD.
Hi, Panika. How
Hello,
are
ma'am.
you?
All good, ma'am.
What's the time there in India?
It's gonna be 9 and 5 minutes, ma'am.
All right. Okay. So, okay, you have presented on the case report on management, non-surgical management of TMD. Yeah. So, how does your management differ from other management? What's new?
Ma'am, what we really looked into, the new thing was the base. We have bought in biobehavioral moderation, ma'am. Biobehavioral moderation at an early stage really helps. It's a non-aggressive way of treatment, ma'am. It's a non-surgical management, and to look at it psychologically and to help the patient who has had TMD that may have been triggered due to stress can be moderated by behavior, ma'am. So it is the new component is the biobehavioral moderation, ma'am.
So, who did the management of behavioral there?
Ma'am, the main crux of it was managed by our senior postgraduate students and the faculty at the Department of Pediatric Dentistry, ma'am.
So, it's the dentist.
Yes, ma'am.
Yeah. Okay. All right. So what is your future recommendation for your again your future? What do you want to do after this, in terms of this?
Sorry, ma'am.
So what is your future recommendation after you doing this non-surgical management to this child? So what is your future recommendation for others?
Excuse
Hello.
me, ma'am. There has been a technical glitch, ma'am. Ma'am, can you repeat your question, ma'am?
Okay. So what is your future recommendation for other practitioner?
Ma'am, the only recommendation, as I have mentioned earlier in the conclusion, was that we as dentists should not only focus on the intraoral examination or around the oral cavity, but should also look into the overall well-being of an individual, that is mentally and psychology, because we are capable enough of assessing the same. So it is essential that we look at the individual as a whole, but not only as a dentist, ma'am.
Right. Okay. This is a case report. So how are you going to
Yes.
prove that your management is okay or better than previous management?
Yes, ma'am.
So how are you going to prove? Because this is only a case report, one patient, right? Panika?
Am I audible, ma'am? Yes, ma'am. Ma'am, I got your question, ma'am. Thank you, ma'am. Ma'am, speaking about this, the only emphasis I would like to lay right now is that it is essential that we diagnose TMD at its initial stages. And when we do diagnose TMD in its initial stages, we are helping the patient or reducing the overall burden they are going through or the overall pain they are undergoing. And that pain may lead to permanent changes as well in them. So it is essential that early diagnosis may be done, ma'am. So how it is different
So
is the only
maybe
reason
you
that
have
sets it
to
apart is we were able to diagnose it at its earlier stages, ma'am.
right. So Panika, maybe you have to do some clinical study to prove your management is okay. All right. Clinical study.
Ma'am, I did
You
not get
can
your question, ma'am.
you can do a clinical study later
Yes,
on.
ma'am.
Okay.
Yes,
Thank
ma'am.
you, Panika. Okay. Thank you.
Yes, ma'am.
Thank you very much.
Thank you, ma'am. Thank you, ma'am.
Okay. Bye bye.
Bye, ma'am.
Thank you, judges and presenters. Next, I would like to invite the next presenter, Presenter 03, Deepak Das and Richa Mandolin, on her research, The Virtual Patient, Guided Implant Dentistry at its most advanced stage to join the Q&A session. However, we will give a leeway time of 1 minute for the presenter to prepare. We will now once again would like to invite presenter 03 Deepak Das and Richa Mandolin on her research the virtual patient guided implant dentistry at its most advanced stage to join the Q&A session.
Hello. Hi.
Hi, ma'am.
Hi. Yep. Can you hear me clearly? I'm Dr. Aziza here.
Yes, ma'am, we can hear you.
Okay. I'll just want to summarize your presentation. You're actually trying to get these different sort of using a different equipment, then you can combine them to give a better result, right?
Yes, ma'am. Yes, ma'am.
That's your suggestions. Have this conclusion translated into a few patients that you have done it clinically, or the school have done it? have it?
Ma'am,
Yeah.
ma'am, actually, studies are going on in this field of dentistry where superimposition is possible, and according to our review, we can conclude that it has been started or it is in progress, ma'am.
But it has not been yet been has not been yet practiced clinically. Is that it?
Yes, ma'am. It is not flourished as a clinical practice right now, ma'am.
Okay.
It's under experiment studies.
Pardon?
It's under experiment
Studies,
studies.
ma'am.
Under experimental studies. All right. I have no other questions. Anybody else? Any other questions?
Can I ask question?
Yeah.
Okay,
Yes, ma'am.
how do you curate out or how do you search for the evidence?
Review paper, macam the first one.
Ma'am,
You put in different method, right? You put in different method of doing the guided implant things. But how do you curate all the information that you have gathered?
okay, ma'am. Ma'am, it is basically superimposing two different methods, ma'am. One is the CBCT. One is by using CBCT scanners, and the other is by using iOS that is intraoral scanners. Okay. With the use of
Sorry. Do you do a review paper or do you do a clinical study?
Review paper.
it was a review poster, ma'am.
Review poster.
Review kan? Review. So when you do review, you collect papers, right?
Yes, ma'am.
You collect papers. So how do you search for the papers?
Ma'am, we search different journals with the assistance of our guide from the Department of Prosthodontics.
So what database do you use to search for papers?
We use Google Scholars. Also, we use other platforms and other colleges, neighboring colleges, the studies they have done like that, ma'am.
Do you have any inclusion or exclusion criteria when you selecting the papers?
Ma'am, we look for the credibility of the paper, ma'am, and with the help of our guide, we do it, ma'am.
All right. I think thank you, Deepak and Richa. Okay.
Thank
Yes,
you,
ma'am.
ma'am.
Thank you, ma'am.
Okay. Nice meeting you. Okay. Bye bye.
Thank you, ma'am.
Thank you, ma'am. Bye.
Okay. Thank you, judges and presenters. So this concludes the poster presentation for today. Please join us on the 13th and 14th of April for our main symposium event via our live streaming channel on our website. There will be research presentations and keynote lectures from our esteemed international speakers. You're also invited to the closing ceremony on the 14th of April for the award-giving ceremony. Your e-certificates will be emailed to you later after the event, and we hope to see you there. Thank you all for attending, and we hope you have learned and enjoyed the presentations.